Yes, Dr. Jaina, we can start actually. We can start, Dr. Jaina. We can start, Dr. Jaina.
Muted.
Yeah, so you are muted, I guess.
All right. Can you hear me all now?
Yeah, now yes. Yeah, we can see the screen as well.
Okay. Thank you very much, Dr. Buddhika and your team for inviting me again for this lecture. And the topic that you have given me is advocacy for healthy lifestyle and safe environment. And yeah, this lecture is a kind of a community medicine lecture, but community medicine also a part of primary health care. And we are also part of primary health care as primary care people. And we also have some role to do work with advocacy role in healthy lifestyle. So it is very important part in our principles and what we do in our practice. One of the very important thing is advocacy role for a healthy lifestyle, especially regarding risk factor management. So my main focus here is to discuss you about this risk factor management, and I mean that the topic I have given is very broader, and it includes counseling regarding risk factors for ill health, diet, food safety,
recording in progress,
physical activity, relaxation, and safe, clean environment. And in this presentation, what I try to give you is to give some concept and how to do this. Not all the theoretical stuffs. So if I give you the principles, so that you can work on other topics as well. So my main focus is to discuss you about the risk factors for ill health, and also teach you how to approach this advocacy role, the concept of advocacy role, and practically how you can do as GPs. So before starting any lecture or anything, we should have some idea about the background and what is happening in our country. So I first few 10 to 15 minutes I discuss about the current situation